HIV is a diagnosis that's rarely talked about, but that needs to change. Courtney Hunter is at the touchscreen to explain why this is a particularly important issue here in northern Michigan in a special report.
Kevin, one county in southern Indiana saw such a devastating HIV outbreak, it sparked a nationwide study on who is at the highest risk. From that study, these 11 northern Michigan counties were among the top 5% at risk for the rapid spread of HIV. In part one of our 4-part series, we dissect these findings, dive deeper into what it means to be diagnosed and how you can get tested.
One person can make the difference, and we're trying to be proactive.
HIV has yet to become a widespread issue here in northern Michigan, but the risk is very real.
The main things to take away is that the things in the model are related to poverty, they're related to opioid use, and they're related to hepatitis C. Because as of right now, we're not finding HIV in those counties, so they have to use another infection that indicates that people have high-risk behavior.
That includes injection drug use. Michigan State Police drug teams say it is unquestionably on the rise in northern Michigan.
That is trending up from past years. So about a third of the cases investigated by northern Michigan drug task forces have to do with heroin, opiates, or prescription opioids.
Breaking that down, about 39% of the North Traverse Narcotics team's open cases deal with heroin and other opiates. 38% of the Sting drug team's open cases involve heroin and opiates, and that number drops slightly to 35% for the same drug team.
With increased IV drug use, there's obviously a larger increase for the risk of HIV transmission.
A very real concern that often goes unaddressed. That's something Munson Healthcare's Judd Care Center is trying to change.
We want everyone in the community to know that we're here. We've kind of been a secret for a long time here, and that we offer free testing, free anonymous testing, and that, if someone has a positive result, we walk you through that process.
Getting tested for HIV here at the Judd Care Center is so simple. I'm going to do it right now on camera for you. All they have to do is, Nanette here is washing my finger off, and she is going to give me a little prick and collect some of my blood, and then within just about 20 minutes, they're going to have results for me. So here we go. Here's the prick.
Ready?
Yep.
Okay. 1, 2, 3, prick. Okay, so what I'm going to do now, I'm going to put the entire sample on the little thing here. In 20 minutes, we'll have a result. And there's no lines, which means it was non-reactive. So what that means is at this point today, right now, you're not positive for HIV.
For those with a positive HIV diagnosis, it means something very different than what it used to.
It's definitely not a death sentence anymore. People are living full, long, healthy lives. And we have many one pill, once a day options.
From counseling to free transportation, there is help.
The goal of the Judd Care Center is to keep people in medical care. That can look a lot of different ways. Connecting you to doctors, making sure that you had your medication, that your medications were covered by insurance. If they weren't covered by insurance, getting you signed up for programs that would help you pay for those.
But you can't get help if you don't know you need it.
We're kind of bracing ourselves and really trying to spread the message of that knowledge is power, and knowing your HIV status is no exception to that.
The Judd Care Center is hosting their 3rd annual HIV Summit this Friday, along with a Northern Lights Fun Run to spread the word about who they are and what they do. For more information on how to register or on how to get tested, head to 9and10news.com.